to add something, what things were done well and what things can improve on, then I'll share screen and show a sketch about chest pain.
Hi, Dr. Saira. So I really
feel free, okay?
I really liked your energy. Your IPS was really great. You did really well. You covered like the main parts which are important in the history. You covered those. You covered all the differentials important in this situation, because this is an emergency situation and you already have the diagnosis through the ECG. So you cannot go through like everything. You just have to manage the patient and ask him to reach the hospital as soon as possible. If in any case the patient says that he or she cannot come to the hospital, what you can do is maybe you can refer the patient to the rapid access clinic, chest pain clinic. He can go there and get himself checked if he doesn't want to go for the hospital. Other than that, it was fine.
Okay.
Yeah, I felt the need to still...
Did you talk about, was there someone near him who can just help him or be with him?
My last sentence was going to be, would you like me to call someone? But then the time ended.
So he you can ask when you call, is there someone near you? I just want to discuss a serious issue. There's something going on. I just saw your ECG and these were the... So you can go on before that. Can you tell me about your condition?
And that was prudent. Yeah, that could have been asked.
Other than that, I felt it's fine. Like,
yes, 100% I agree. So I want to add a few things. So in a different way, then we'll try another scenario as well. And being a accident emergency doctor, so the situation was dealt very well. So I would say she dealt everything, but few things which can be improved on. I'll speak about those. But before that, I'm going to quickly share the screen. I'll add things what she have done and what things we can improve on as a doctor, because there is always one thing that what things that we call action plan, what as a doctor we could have done better in our consultation. So these are the things that all the time we think as a doctor. So if I show you this acute coronary syndrome, so in that one, she took the old Socrates, where started, how, when, how long, suddenly, gradually describe pain. So she asked me, I said, it's a dull pain. And she asked me, is it moving elsewhere? Yes, I said, yes. So that means that showed it's not only angina or something serious going on. Have you tried any pain relief for that? I think she asked that, but it's worth adding, any spray was given, or do you have any spray at home at that point? Because you need to ask that thing, you need to ask if they have tried anything. So she did ask about sweating. Those are the red flags. So those are the red flags about the sweating, vomit. She did ask about, do you feel like sick? She did ask about leg pain, or that ruled out PE and DVT. And then she did ask about any problem with the breathing. That could be pneumonia and cough. And that was not necessary here. Travel history, heartburn, rash was not necessary here, because rash, when we ask someone old is coming and they have recent flu or fever or pneumonia-like symptoms. So we can rule out few of the things, but we already know that this condition is an emergency situation. One of us asked to make sure that he's safe and how you are going to do the first aid for the patient. So as soon as you take history, Socrates and everything, what you could add few more things. He did ask about DASA, but if one thing we could add on, so according to the signs, symptoms and everything, we can tell that who else with you at home, okay? Have you tried any spray, or do you have an aspirin at home? Because if the symptoms are consistent with the presentation, like patient might be having heart attack, or maybe going into heart attack. So the most important thing is that providing first aid. So we can say that in the meantime, can you please open your door? I'll be ringing in the middle of consultation. You will say, I'll be ringing an ambulance for you. They would be with you in the meantime. And before doing the lifestyle and everything, they would be with you in the meantime, but I'm here with you. And if call drops or anything, I'll call you back. Don't worry, stay relaxed. If you have any spray at home, try that. Or if you have aspirin at home, you ask that question. If the patient, he says, yes, I have the aspirin, okay, can you take that aspirin for now for me? Is that okay? You tell that 1 tablet or 2 tablet, that is the first aid to save someone's going into the MI or heart attack. Apart from that, Maftoza's question was fine. So that is score. So she did ask about,
420.
Can you please mute your mic, please? So hard score, she did ask about smoking and everything. That was perfectly done. The expectation concern was
Missing.
not there, but I know it was a situation where it's like emergency situation. But if you get time, you can say that, Michael, you are in the pain at the moment. I know you are worried, but what you are thinking at the moment, what's coming into your head, what you are worried about. Okay. Then he would say, doctor, I'm thinking it could be heart attack or it could be something like that. So when you would say, in the meantime, ambulance would come, they would provide you, you don't need to panic, you don't need to worry, just stay calm, open your door, open your door straight, that they would come inside. I will give your postal code and your address. They will come straight and will get you from there. And they might provide you some medication like aspirin. They will do ECG straight away again. And if oxygen is required, they will give you oxygen as well. They will take you to the hospital. They will take you to the hospital, nearby emergency department. What they would do there, they would do assessment again, and they would do the electric pacing of your heart, and they will do the heart markers. And if needed, they will do X-ray. Okay. In the meantime, so explain that you don't need to worry. We have a lot of options there. In the best case scenario, what we would do, best case scenario, if just a slight block, we'll just give you some medication that would be relieved. But in worst case scenario, if it is a heart attack or it's going through something block, we might need to do further interventions that might include stenting like your father had. So you explain those things and check and chunk method. Are you with me? How are you feeling at the moment? Are you okay? So these are the things what we can do. DASA was done. Everything was done. Apart from that, the management should have started early. Everything was perfect. I would say everything was perfect. From my side, what I